There are two different types of diabetes. Type 1 diabetes is usually in younger people. Those diabetics will experience vision changes, vision loss a lot earlier. So we worry more about the type 1 diabetics. Type 2 diabetics are patients that are a little older, have developed diabetes, usually in their 30s to 40s, as opposed to a child having type 1 diabetes. Type 2 diabetes usually presents a little later. The difficulty is when you are first diagnosed with diabetes, you need to have an eye exam. That is the overarching theme to all of this. And not only do you need to have an eye exam, you need to have an eye exam every year, especially if your diabetes is not well controlled. So, in kids who are developing diabetes at a younger age, and it's scary now because we're seeing children develop type 2 diabetes, which is a phenomenon of the change in the diet, the change in the activity levels of children. And so when they're developing these diseases a lot earlier, we're having to do cataract surgery a lot earlier. We're having to do treatment for the bleeding and swelling and changes to the retina a lot earlier. And so being able to pick up these changes and treat diabetes more aggressively, um, is really the most important thing. So once somebody is diagnosed with diabetes, they need to go and see an ophthalmologist and get a dilated exam so that we can check to see if there are any blood vessels that are growing, any swelling to the center of the vision. So those are the most important parts of diabetic eye care.
So you've shared a little bit with us about younger individuals or children. Tell us about seniors. Clearly, getting the eye exams every year is extremely important, but tell us if for seniors, is it still every year or is there a more quick, sooner time, shorter time frame? How does that work?
For seniors, it's even more important because we know that falls, difficulties in navigating, whether it be driving or, whatever transportation um, that they may be using, it becomes more and more difficult to manage your other comorbidities, whether it be high blood pressure. All of these things are more and more difficult as you get older and can be even more difficult in the senior population if they're having changes to their vision because of diabetes. So, definitely, patients who have had diabetes for a longer period of time become at higher and higher risk for having some of the diabetic retinopathy or changes to the retina because of their diabetes. So it is extremely important in our senior citizen population for them to have diabetic eye exams at least every year. Because we can also pick up on other things. We can pick up on cataract. We can pick up on dry eye. We can pick up on any glaucoma changes. All of these can be diagnosed with the eye exam with the ophthalmologist.